Yeah, I'm the mother.
What brings you here today?
Dr. Levine wanted me to see you because my tumor has grown. And,
Dr. Levine, is he a neurologist? Is Dr. Levine a neurologist?
She's an oncologist.
Oncologist,
Yeah.
Oncology.
Mm-hmm.
Do we have
She was trying to get a hold of you. She wanted to talk to you before I saw you.
Yeah, I have the number. I can easily call her. Did you have a new scan?
Yes, I had an MRI.
MRI, when?
When was
Last
that?
Wednesday.
Last Wednesday, yeah. And she called me the next day.
Yeah. Let me see. Today is the...
Today's the 16th.
16th was the 9th.
It's Dr. Levine.
Yeah. Do you have more headaches or more symptoms?
I'm having headaches, and I did pass out one night about 2 weeks ago.
Okay. They didn't give you a disc or something like
No. No.
Okay.
Dr. Levine.
Good morning. This is Dr. Muselaar, neurosurgeon in Huntington.
Oh, okay. Hi, how are you?
I'm good. I'm here with our mutual patient, Miss Donna Harper.
Yes.
You sent her back to me?
I did. She had changes on her MRI with growth in both lesions, actually.
Yeah. And does she have more hydrocephalus with it or something like that?
She does not, but she's symptomatic, which made me very uncomfortable.
Yeah.
Not describe anymore.
No. Of course, the MRI scan is not here. That makes it pretty difficult. Do you feel that she might be a candidate for stereotactic radiation?
I think it's a little bit. Hold on just a second. Let me pull her up and everything.
Yeah.
Harper, Donna. Okay. Imaging. I'll read you what they said. Of course, it didn't have contrast. Redemonstration of the abnormal lesion, which appears to occur within anterior aspects of the fourth ventricle, extends inferiorly posterior to the medulla.
Yeah.
Components of the fourth ventricle do appear enlarged in comparison to prior MRI.
Yeah.
So it's 2 by 2 versus 1.5 by 1.5.
Yeah, and sometimes small differences can make a big difference in that area. There is not much space there. Yeah.
The nodular, the component posterior to the medulla is now 12 by 14, and it was previously 8 by 13.
Okay, let me quickly write it down. So in the fourth ventricle, that has increased from 1.4 to 2 centimeters.
2.1,
2.
And then the nodular component posterior to the medulla has gone. It's now 12 by 14, and it was 8 by 13.
Yeah, so it's clearly growing. What shall we do? I think what we should do is, well, we need her MRI scan here. We'll get it in some way. I'll make sure of that, and then I'll probably will discuss it with the other neurosurgeons and see what we should do exactly.
Okay, are you on Epic out there?
No, we don't have that anymore. We are on what's that called? Cerner.
Oh, okay. Okay. I can, so, you know, when I talked to your secretary or nurse,
Yeah.
they said that they were gonna, they said, don't worry, we'll get the imaging.
Oh well, maybe it is here. I didn't have it with my. I'm in a room where the computer doesn't work very well. Well, yeah. Do you have a second to? It's great that doctors talk to one another. That should happen so much more.
Yeah, so it's been 3 years since I treated her, at least.
Yeah.
It was 2015 when I had the radiation.
Well, she had radiation in 2015. She tells me.
2015, gosh, so it's 8 years, huh, Donna?
Yes, yes.
Okay. I keep looking for the T1 post-contrast, but that's not going to show up.
Of course, this computer. Where is the freaking X-rays? Yeah, get there another way then.
I'm trying to find the portion in the fourth ventricle. Yeah. So it would require 2 separate stereotactics.
Yeah, well, that is well possible, of course, but no. And in our radiology system, see what we have on her here. Harper,
Okay.
Donna. It is thinking now. Donna Harper, 1A, CT angio. No, we don't have the MRI brain, October 22.
You don't have this one from August 9th?
But wait. Well, no, we certainly don't. We have several Donna Harpers, but this is her, and she had a brain in October of 22
And that's the last one you have?
at Pikefield Medical, yeah.
Okay.
So it was compared to a scan of less than a year ago, and it has grown considerably.
Yes, it has.
Okay, no, I don't have the newest one. I think what I should do is simply get it in some way, and we can do that. And then I will discuss it with my colleagues and probably even with our radiologist,
Your radiation?
radiation, and see what would be best for her.
That sounds great. I mean, if it's a stereotactic, which obviously would be very futurist for her, I mean, if they think that they can do it there so you can be involved.
Yeah, we do that together with the. Although our radiologist is very good at it, he doesn't need us really. But we always talk about it and discuss together what the best solution would be. So we'll get the MRI scan in some way. We'll discuss it, and then I'll discuss it with Ms. Harper and see what needs to be done. What I gather, it's probably likely we will do radiation, but maybe it's easy to remove the tumor out of her fourth ventricle. We'll see. I'll take care of it.
Okay. All right. Thank you so much. And You'll let me know what you decide?
Yeah, of course. Yeah. No, it's fantastic that we have a doctor who cares and who doesn't mind talking with another doctor.
No, I love that. That's wonderful.
So do I.
Just let me know what you decide to do, and if for some reason you cannot get the imaging, please give me a call.
No, we can always get it. I had seen her in October 20,000.
Right.
And did you get my letter of that?
I did, and it said to order a
Yeah.
CD,
Okay.
which I did, and that was stable.
Yeah.
But
Okay.
then I was on vacation, and she called in with symptoms, and I said, just get her a stat MRI. We're not going to muck around.
Yeah. Very good. We'll take care of it and we'll be in contact hopefully soon.
Thank you so much, doctor.
Thank you. Have a good day.
Okay.
Bye bye.
You too. Bye-bye. Bye, doc.
Bye.
Okay, well you heard it. We're going to try to get the. Do you feel that you have more symptoms?
Just that I
unsteady
can't
or-
eat. I cannot eat.
Why? Because you're nauseated or?
Nauseous. In the morning I gag, and sometimes it's really bad.
Yeah, that could come from that particular area.
Oh, okay. So-
Okay, we'll get MRI.
I thought maybe the gagging was from mucus in my throat or foods that I was eating, something like that, but I'm just having.
Dr. Fan's free right this second.
Oh, good. She can go, but we need her MRI scan in Pikeville.
Oh.
You said you would get it,
I sent a
but it is
request.
not here yet.
Oh.
But I'll, when we get it, we'll need to discuss it with all the neurosurgeons
Okay.
and Dr. What's his name, the radiologist.
Okay, so then you'll call me and
We'll
let me
get
know
in
what
touch
you
with you.
decide. Okay, all right.
So the throwing up is from her head.
I think it is, most likely, yeah. Where the tumor is, that is causes often only nausea.
Okay.
That's why I
Can
can't
she
eat.
fly?
Oh yeah, can I fly?
You can, but I wouldn't do it at the moment. Where do you want to go?
I want to go to California and see my sons.
Yeah. Yeah. You feel good enough that you're not nauseated all the time.
It's not all the time. It's just in the morning.
Yeah. Fly in the evening.
I,
I would
What
wait.
about nausea medicine for
That
her?
doesn't help.
No.
For
Oh,
these
it doesn't.
problems,
no, not for this. It wouldn't.
no. I would wait flying until we have talked.
Okay.
That will happen within. Well, we have a conference next Wednesday.
Should be.
We always have conference on Wednesday morning.
Oh.
By then I'll have your MRI scan and I'll call you right after that.
Okay.
Yeah?
Okay. So next Wednesday.
Yeah.
Then. Okay. All right.
Yeah, as
Good
long as we get
girl.
on.
Sorry you had to make this long trip. But
I know. Sorry, I had to come back.
Yeah.
After 8 years, that's weird.
I know.
Yeah, as soon as we get done today with all this, I'll call Pikeville, make sure it gets here. I faxed them a request, I think Monday.
And they're usually really good about doing it right away. So maybe
Yeah.
they didn't get the fax.
Could be our fax. Well, it's not a
Right.
machine anymore, but
I know exactly what you mean. Yeah.
but yeah, you're free to go, and I'll make sure that gets here before next Wednesday.
Okay. All right, and then he'll call me.
Yeah.
Oh, when he calls, have him call on my cell phone instead of
Is
the
that your
house.
main number you gave them?
I gave them my house number and my cell phone number.
Let me write it down just in case.
Yeah.
What is that number?
606-792-5927.
And that's your cell phone.
That's my cell phone. Yeah.
Alrighty, we'll keep that.